As far as nutrition goes, what I see in my community, many people are lacking food. Many people don't have staple food. Whenever they migrate from the village, they come back to the center, they don't have food, maybe they don't grow food. There is no enough garden for kitchen gardens.
Despite the fact that Bungoma is producing a lot of food, utilization aspect is still wanting. Some of the issues that are affecting Bungoma people are things like deficiencies, things like lack of clean water.
For sometimes we have food deficit in that what is harvested does not take the farmer from that production's time or harvest time to the next harvest.
The most negative practice in our locality is that people prefer ugali than any other thing. And some other times they have been practicing like one kind of vegetable.
Nutrition is a problem, and some of the causes is high levels of poverty. Children, you find that quite a number of children are malnourished.
Currently, the rate of exclusive breastfeeding within the county is 32%. We'd like that percentage to go up. And those children who are stunted, we are at 32%.
Malnourished children, most of them were also babies, and it seems they were defaulting, and some of them were not adhered to drug.
This concept of integration, this holistic approach, is what brought us to agri-nutrition, when we realized it's not enough to teach farmers to grow better skooma or introduce new varieties. If they're not cooking it properly, if they're not eating it, if they're not accessing it regularly, they're not getting the benefit at family level. So it was bringing this integration of nutrition into the agricultural part of our project that led us to define a new and exciting way of bringing agri-nutrition into all of the areas of our project.
This is a program that was supposed to have come like yesterday. These are the simple areas that people normally overlook, but they are the things that really affect the health of our people. And we know when people don't have good health, they cannot do anything to spur the economic development of the country.
The role of USAID KHCP in the development of the agri-nutrition manual and toolkit was to coordinate the stakeholders, the GOK, and other partners.
So the role of the Ministry of Agriculture, in collaboration with the Ministry of Health and other stakeholders at that time, was to document the technologies and the messages to ensure that even whatever we produce is utilized well for good nutrition.
The role of the ministry in the manual is mainly to provide the technical support and also to provide policy direction.
We are working through a network and a consortium of partners, primarily with the government, but also national partners, particularly our lead partner with AMREF, but also other major partnerships in many of the counties of Kenya.
So this project is in line with what we do in that it empowers communities, and it also aligns with our strategic directions 1 to 4, which is really focusing on the health of women and children. And again, AMREF believes in the power of partnerships, and because this project brings different stakeholders together, this is in line with what we do and what we believe in.
Through this partnership, the Applied Basic Agri-Nutrition Resource Manual, developed in collaboration with the Ministry of Agriculture, Ministry of Health, and USAID, was launched in Nairobi in May 2013. The partnership was implemented through reaching out to individual households in 16 counties across the country.
Yeah, thanks at the community level, we're having so many activities targeting nutrition services, mobilization of the community to change their behaviors towards consumption of some food products that were not majorly embraced across the county.
Through the KHCP project, we started partnering with AMREF on promotion of nutrition, and through that partnership, they trained our staff. They also provided us a nutrition manual for training of community members in nutrition. So every time our staff go to the field, they train community members on issues of nutrition, which kind of crops can be grown for nutrition purposes.
We were trained on the value of nutrition, good nutrition, and on how to select the kind of food, on how to prepare this food, and also on how to serve the meals to families.
Katika hii agri-nutrition, kuna zile vitabu tunazipewa, ziko na mapicha ndani za zile fruits, animal proteins na plants. So tunapoenda field, tunaelimisha mwanakijiji jinsi ya kutumia hizo vitu, na pia tunamwonyesha katika picha hizo.
Nimeshapata mafunzo kutoka kwa wenzetu ambao walienda kwa mafundisho, walikuja wakatufundisha jinsi tunakula, jinsi tunapika mboga. Wengine wakiona vile ninafanya, hata hawa wanakubaliana jinsi wanaona vile ninafanya, na hawa wako na hamu ya kutaka kujua.
There was a lot of acceptance of these documents because first of all it is highly simplified and it had almost all the information that one would need to be able to produce and utilize the food correctly for good nutrition.
Through the tools and the manual, we are going to one, strengthen the linkages between health and agriculture. We are also going to work together with agriculture, the extension workers, and the health extension workers to work together towards improving the knowledge on nutrition and the utilization of local foods so that we can reduce mortality, especially infant mortality and morbidity.
Tunafunzwa jinsi ya kupika, kula, kubadilisha vyakula, yani balanced diet.
Tumefunzwa venye tunapikia, venye unatengeneza usafi ukitengeneza chakula, venye unalisha watoto kwa masaa, venye unapea chakula safi, unawaosha, unafuonja mkono venye wakati unapika.
Upande wa lishe bora imewasaidia watoto. Manake naona tangu tuanze kutumia lishe bora, watoto wangu naona afya yao inazidi kuboresha.
Tangu nilianza masomo haya, niliona hata kiafya ugonjwa ingii kila wakati. Hata wakati ninaenda hata kazi ya shamba, ninafanya tu, ninasikia kama niko na nguvu.
There are a lot of changes. People have known what types of foods to eat. Before that, one could sell an egg to buy bread. So ideally, all our ladies now know that don't sell an egg to buy bread, but use that egg for your own child. They have known the importance.
We are happy that the nutrition is gaining access, adoption, and also there is sustainability because of being adopted by the government.
The program is sustainable. Why? Because from the TOTs that we have been trained, we are now training others who will continue with the program later on.
This is a program that we are going to put a lot of efforts on, and I believe we are going to sustain the training programs. We are going to sustain all the activities that can support agri-nutrition aspect of the county.
Agri-nutrition has a fundamental aim, which is achieving change in household family level. Healthier children, healthier mothers, healthier families as a whole.
you.